How is everybody for a Monday? Everybody doing all right? We are in week 8. Crazy, crazy, crazy. So, I've got some housekeeping. I don't have any of my Friday students here. I was hoping some of them would come because, of course, Friday's a holiday, so we don't have class. Um, anyway, I think I have everybody here except Alaya, who is not coming. So, everybody needs to be on camera. Everybody looks good. Cynthia's probably still, oh, there you are. Okay. Jatarius, can see you. Vanessa, I can only see the ponytail on top of your head. There you are. Okay, great. Thanks, guys. All right, so a couple of things. Welcome to week 8. Today we're going to cover week 7 content and week 8 content. Okay, I sent you the exam 3 study guide this morning. So make sure you take good notes. Okay, has all the concepts listed, but make sure you take good notes this class and next week because those are the 3 weeks. Now you do have your weekly notes that I give you, so those are pretty detailed, and that's what we'll use to cover the content. Okay, we'll take quiz 5 after we go through the housekeeping issues. My plan is take quiz 5. We'll review content from week 7 and week 8. And then what I'd like to do is some short presentations of your group projects. I graded them all this morning. They were good, really good. The one thing that was missing from most of them is I think it's the fifth item in the rubric that says describe a life in the day of somebody with whatever you were researching. And then the only other issue was to get the full point, you need to have 5 references. So I had to back that out a little bit if you have 4, if you have 3. But as far as the content of all the group projects, it was fantastic. Fantastic. So really, really nice job. Very proud of you guys. So at the end of the class, we'll spend a little bit of time and we'll do just a quick group presentation. It's nothing formal. It's just taking the group and talking about what you did. And I would actually like to, since I don't think anybody answered a life in the day of somebody with whooping cough, I'd like to kind of talk about what do we think that day looks like, since it really wasn't covered um, in the paper. So that's how I want today to go. Hesse, so this week we only have a quiz. That's it. That's all we have to do this week is a quiz. So this would be a good week to start getting caught up or keep working on your, I know it's a holiday week, it's a short week. But if you can do some work on your Hesse prep assignment that's due next week, week 9. So week 9 is kind of busy. You have your Hesse prep assignment due. You have your third NCLEX due, right? And remember, week 9 are exam reviews for the third exam, right? Because the third exam is in week 10. So make sure you take a look at the master calendar and see if you can prioritize trying to attend one of the 3 reviews. Okay, I think that's it for week 9. Oh no, you have a case study. That's your second case study. You have 4 things in week 9. Okay, so with only having a quiz this week, you could technically do your case study this week or do your NCLEX. Several people have already done the week 9 NCLEX, so I'm okay if you work ahead with week 9 projects since you have several things due in week 9. And I haven't locked anything. It's all open. Okay, so that's my suggestion. And then, of course, you have your vulnerable populations assignment, the research paper on a research PowerPoint on a vulnerable population within your community. All right, a research paper about that. So that's doing week 10. I'm going to look, I just didn't have time this morning. I'm going to look at the master schedule for Hesse, Campus Hesses. I'm thinking that there's several campuses should have picked the date that they're doing the HESI. Have any, let's see, what do we have here? We have Cuyahoga Falls, Orange Park, Pensacola, and Port St. Lucie. Have any of you guys received emails from your campus yet about scheduling your HESI?
No, not for
Okay.
ours.
Okay. All right. I have a master schedule that campuses fill in. And so I haven't even looked to see, but usually by week 8, there should be several campuses. And all they do on the spreadsheet is put the day and the time that your HESI is scheduled for. It's up to you to go to your campus and register. And if you don't have emails yet, maybe they haven't picked the time yet, the day and the time. Okay. But I'll go through the master calendar at least today, this afternoon, and I have a little spreadsheet that I send out to all of you that says, hey, Pensacola's HESI is scheduled for Tuesday, December 9th, whatever, at 1 o'clock. So it's just to inform you when it is. Okay. So I'll do that. I'll try and do that. And then my last housekeeping was happy Thanksgiving to everybody. Hope everybody can find the time to take a little bit of time off to enjoy family, friends, and the holiday. I believe we have Thursday and Friday off. So try and take some time. I know this is an incredibly busy semester term for you guys. Um, so wishing you all a really happy Thanksgiving. Okay.
Thank you. You too,
Thank you.
Professor.
You.
Thanks. Oh, exam 2 grades I posted over the weekend or Friday night, with the email attached to it that anybody that wants to review their exam, please reach out to me. I've had a few students reach out to me that want to review the exam. Have several tutoring sessions this afternoon and some tomorrow. I haven't heard from a lot of students yet. Of course, my recommendation is that if you score below, I even say below 80. If you scored below an 80 or definitely below 78, reach out to me and review the exam. What we do is we'll review concepts that you missed and go over some of the questions you missed. Okay. If you scored above a 78 and you still want to review your exam, that's perfectly fine. Happy to do it. Okay. So I can't help you if you don't reach out. Okay. So now we're done with 2 exams. I've turned the homework grades off. Right. So your total grade in your grade book is your actual grade of KGAs. Right. So that's 2 exams and 4 quizzes. All right. I don't think I have any homework issues in this class. So I try and stay on top of you to get your homework done. So any questions? That's all my housekeeping items. Does anybody have any questions? Okay. All right, let's go in and take quiz 5. Quiz 5 covers a lot of different topics. Elia dropped the class. She told me to tell you. Okay. Thank you. It covers a lot of topics because in week 7 and week 8, we covered lots of different concepts. So go ahead and start quiz 5. Let's see, it's 312, so that's 315. Let's go to 330. How's that? And then you got to stay on camera. When you finish, if you want to go get a drink or something, that's fine. But stay on camera during your quiz, okay? But we'll restart at 3:30. All righty? Good luck. Well, it looks like everybody's done. Okay, so when you have a minute, I'll come back onto camera. That would be great. And we'll go through it. How'd you do? Did you do okay? Good. Cynthia, what?
I didn't do well.
Why?
I
Why?
got the one for the rubella. I thought it's influenza because I didn't think that the pregnancy would apply in the case of
Bella.
rubella.
Yeah, you should
And
have caught. You guys should have learned that in OB, right?
mm, maybe.
Okay. All right. Let's wait for the last couple of students to come back on camera, and then we'll review the quiz. We covered, like I said, a wide range of concepts. So if you did well, hopefully you prepared well for the classes, both week 7 and week 8. Jataria, see you around? Celine? Jataris, I don't know if you're there. I'm just looking at a black screen. Celine? There you guys are. Okay, all right. Let me share my screen and let's go ahead and review the quiz. Celine, you there? Okay, there you are. All right. Okay, can everybody see my screen?
Yes.
Okay. Okay. So this is good practice for exam questions as well. The school nurse notes several children developing a pustular rash on their face and extremities following several days of fever and malaise. Which step should the nurse take next? Before we even look at the answers, what is one of the concepts we cover in week 7 that we would need to think about?
Smallpox.
Yeah, well, bioterrorism and disaster, right? That's one of our concepts we cover. So you need to be thinking smallpox, right? Did anybody get this incorrect? Okay, Cynthia, what were you think? What did you select?
I can't see it because I picked the one for the vaccine.
Okay, assess their vaccine records for the varicella.
Yeah.
Okay. Why is that incorrect? Why is Cynthia's answer incorrect?
Because they don't have chickenpox.
Yeah, these are not these all these
And
this is not
varicella starts on the trunk, doesn't it? On the
correct.
trunk of your body.
Correct. So these are not initial symptoms of chickenpox.
Mm.
All right, Cynthia.
Okay.
Recommend a follow-up with the pediatrician when better? No, it needs to be looked at the moment, right? With the pustular rash on their faces and extremities and several days of fever. Okay, if you've got several days of fever, we're just not going to hang tight and wait for it to go away. It's got to be assessed. Okay. And then the last answer, evaluate scalp and excoriation marks for lice. These are not symptoms of lice. Okay. So because one of the concepts we're looking at is bioterrorism and disaster, and having read about smallpox, you need to be suspicious of a potential smallpox outbreak, right? Okay. So the nurse is caring for an immigrant who was pregnant with their first child. There are no vaccination records available. Which vaccination should be prioritized? Obviously, rubella is the correct answer. Why is that the correct answer? Why does rubella need to be prioritized?
Because it can affect the baby when it's born with like if the baby gets rubella, if the mother gets rubella, then the baby can too and can affect the baby.
Right. Well, what can be said that measles doesn't do the same thing, or varicella or influenza?
It's not as serious as rubella.
Right. Exactly. Did anybody get this one wrong? Or Cynthia, you said influenza.
Yes.
Okay.
I did too.
Okay. You did too. Okay. So this should have come from OB. Okay. Rubella needs to be, in the absence of any vaccination records, rubella has to be prioritized.
It could
Okay.
also do like miscarriages too and stillbirths, rubella, and deafness.
Mhm. Yep. Exactly. Yep. Okay, so now the health department's caring for a 16-year-old female with a new diagnosis of gonorrhea. Which education should the nurse provide? So this could, if you look at A is not, continue antibiotics until the symptoms are gone, right? Why is that wrong?
Because you need to finish them even if you don't have symptoms.
Finish them all. Finish the whole
Correct.
prescription.
Right. You don't just stop when symptoms are better. All right. B, the correct answer is one of the potential complications, right? If they're complaining of any pelvic or abdominal pain, especially with a fever, right? So that is the correct answer. Why is C an incorrect answer? No need to interrupt sexual activity as long as you're using condoms. Why is that incorrect? Why is that incorrect?
Because it's not enough protection.
And maybe it could still spread too.
Mm-hmm. It can potentially still spread. Yep. And then D. What about D? Why is that incorrect?
Because it doesn't matter and it's not important priority information.
Okay.
That one was a little tricky because I would have thought that one too.
Okay.
Provide names of any sexual partners in the last 6 months. I feel like that would,
Well, that's a kind of a confidentiality and privacy issue, right? What are you going to
Okay.
have them contact those people? Maybe the better would be, please communicate with partners over the last 6 months. What's going on? It's not up to them to communicate.
call them. Right.
Does that make sense?
Yeah.
So that's an invasion of privacy.
Mhm.
Okay, occupational health nurse is caring for a
What
client
you
who
need?
just, pardon me? Oh, occupational health nurse is caring for a client who just sustained a needle stick injury at work. Which education should the nurse provide regarding HIV testing? Okay, did anybody get this wrong? Did anybody select anything other than C? Okay, why is A wrong?
HIV tests are not immediate. You don't get an immediate response. It takes 12 weeks for.
Could take up to
It's-
12 weeks. Yep. Yep. And then B's wrong, right? Because there's no need for that. There's no need for B. If you're retested in 3 months, that should be it. Okay. And then D's obviously wrong. Okay. So in your notes, return for another test in 3 months to determine exposure, since it can take up to 12 weeks for it to show. Okay. When the nurse is developing a primary prevention program for TB, which intervention is appropriate? Remember, primary. You're trying to prevent something before it happens. Okay, so what would we be looking at on the front end to try and prevent the spread of a TB? What are some of the reasons that people are at higher risk for developing TB?
Crowded
In a home.
location.
Is C. Crowded living conditions and community homeless shelters. Those are really high risk environments for TB, correct? And so if we can try and reduce those two things on the front end, that's prevention. Okay, what is A? Primary, secondary, or tertiary?
Tertiary.
Tertiary.
Second.
It's actually secondary.
Secondary, okay.
Right? Right?
Patient.
Because you've identified a group that's at risk. So you've screened. We know that the residents live in a homeless shelter. So you've already identified that group to be at higher risk. All right. So now you're going to educate them on signs and symptoms. Does that make sense? They don't have it yet, but because of their location, they're a high risk group. Make sense, Tiara?
Yes.
Okay. What is B?
That is tertiary, because they already have it.
Because they're on antibiotics for it,
Yes.
correct? What about D? What is D?
Is it
Secondary.
Secondary.
Yep. What are you doing? You're screening,
Screening.
right? Screening as a new employee. Okay. Number 6, home health nurses visiting a client recovering from a right hip replacement performed 8 days ago. Client is complaining of calf pain in the left leg. Which nursing intervention is a priority? All right, let's break this down before we go to the answer. Let's break this down. That's a long question with a lot of information. Let's say you're using the highlighter in the exam soft. What are you going to highlight? See, this is a good question, that there's so much information in it. Is it all necessary? And can we try and rephrase it in simpler terms? So what do we want to pull out of this question?
A right hip replacement
When?
8 days ago.
Right. So that's one hint. 8 days ago. Surgery 8 days ago. Okay.
And calf pain.
Calf pain. Doesn't matter which leg, right? Calf pain. So what is a priority? What are we thinking there? Think med surg. What are we thinking? What is
DVT.
after 8 days, what is the client at risk for?
Blood
A
clot.
DVT.
Yeah. Right. So what's the priority? If they're at risk for a blood clot, you want to examine or assess the calf for edema or erythema, right? Potential symptoms of a blood clot. Okay, why is B wrong? Evaluate drainage from right hip wound.
Because that's not the,
There
For
shouldn't be
the
any
that's the
drainage.
left leg.
right,
Yeah,
for
he's
you
complaining of.
overthinkers, where in the question does it tell you that there's drainage coming from the wound? Right? Doesn't say that. Okay. Discuss the use of PRN pain medication. Well, after you do A, which is the priority, right? You could discuss the use of pain medication, but that's not what it's asking. It's asking what the priority is, right? So that's a good example. We've talked about this before in the other quizzes. This question is a good example of lots of information, but a lot of it we don't need either. So if you're using the highlighter, like we said, we're going to highlight that the surgery was performed 8 days ago. Calf pain, like Kadisha said, calf pain, at risk for blood clot, right? But this question is also a good example of if it's not a select all that apply question, and maybe one or two other answers look like they could be in the ballpark or correct, what do? We've talked about this with all the quizzes. What
What's
do you
the
do?
priority? Like what's most a priority?
Right. Okay. But what do you do if something else looks correct? Remember, you go back and review the question and see what you might have missed. And that's why I encourage you to use the highlighter, because there were 3 things in this question you could have highlighted. Then you get to look at the answers and you say, oh, well, maybe C could be, but it was asking what's the priority. Priority was A, and then you can go back and do C. But the question was asking for priority. Okay. Any questions about that? And remember the 4 things we talked about with answering questions. We broke it down for those of you that attended the review, exam 2 review, we broke the 4 questions, broke the 4 things down that are important when you're tackling questions. What are they? Remember that PowerPoint we went through? Critical thinking and breaking down questions. What were the 4 things?
Was one like the positive and negative questions?
Yep. How is the question framed? Positively or negatively? Right? Because there are positive and negative questions on all the exams. Give me an example of a negatively framed question. You just had some on exam 2. What are you looking for in a negatively framed question?
What would like not be adequate teaching for a client? Or what would not be
What needs
good
corrective action,
corrective action?
right? So you do teaching with a family of, we've talked about this before, you do teaching of a family that has kids that are asthmatic, right? And they're smoking. What does the parent say after you're done teaching that requires more teaching? So they're saying something incorrect, right? So positively or negatively, that's one. Second is, what were the key words? What are you going to do with the key words when you're reading through these questions? And this quiz is a good practice for your exam questions. How are you going to identify the keywords? Use the highlighter, right? What words are we looking for? Priority words. What are priority words? What are priority words?
Pain.
Pardon me?
A pain. Any pain.
Greatest,
Okay.
right? Virginia, what are some priority words?
Like could first or
Mm-hmm.
like saying what comes first, kind of.
Right. What's the priority? What should you do first? What's the greatest impact?
It's like, what's the most important?
There you go, Lakeisha. Great. Most important. What are some other priority words? This is why I like to review these quizzes, because it's good practice for these exams. What are some other priority words? What do you do first? What do you do last? You have to be able to take those words out of the question. If you're not, if you're going too quick and you're reading these questions too fast, you're not going to pick up on those words. Right? So identifying keywords. And then remember, for you overthinkers, when you're answering these questions, if the information is not in the question, does it exist?
No.
No. Selena, you there? It doesn't exist. A lot of you, when I do exam reviews and ask why you picked that particular answer, you start talking about something that is not even in the question. And when I say, where did you get that information? You just thought about it. Make sense? All right. I know we're getting off track here, but I think this is important to review. So I don't have great review attendance, and I don't know if you watch the recording. So I always like to go over this. So the third thing is we talked about positive versus negative. Number 2 is identifying keywords. So I really encourage you to use the highlighter. Third is rephrasing the question. So let's go back to that really wordy question we just had. This one. Whoop. Sorry. Somebody rephrase this question. Question number 6, rephrase the question in simpler terms that you can understand. Taking out the information that really doesn't matter. How would you rephrase it to be simpler?
I would say,
I
go ahead, sorry.
No, go ahead.
You can.
oh,
Adisha, you're given the floor there. Abigail gave you the floor. Go ahead.
Sorry, I would just say like the client is recovering from a right hip replacement and is 8 days ago and is complaining of calf pain in the left leg.
And what's the priority? Yeah. Okay. Everybody understand that? Can anybody simplify it even more?
Maybe oh, it just slipped me. I'm sorry.
No, go ahead.
Maybe like what would you assess for possible or like signs and symptoms of a DVT after surgery, maybe? I don't know where I was going with that.
Well, but hang on. Who
Me
says
pers-
there's a DVT?
right.
Yeah, I just
You're adding information that's not there. Right?
Yeah,
yeah.
but I think stop access what is the cause of pain.
Celine, hang on. Celine, you're in your car.
Yeah, I'm here in the class.
No, Celine, you can't be in the car. Where
I'm not driving.
No, it doesn't matter. Celine, where were you just a minute ago? Weren't you on campus?
No, I'm on the campus.
Where were you when you were taking the quiz?
Am I home?
Okay, you need to log off and come back on when you're back in your home. I can't have you in the car. I'm sorry.
Okay.
Okay, thank you. Thank you. Okay, let's keep going here. The last of the 4. What was the last of the 4? Negative, positive, negative, keywords, rephrasing. Oh, eliminating answers. You guys know, we've talked about this before, you have that option in ExamSoft to put a line through answers when you go through the answers for the first time, the ones that you know are not correct. Right? That's always a helpful feature. So that when you go back and look at the second time, maybe you're only trying to pick between two answers. All right, so those are your four. Those are your four key in that PowerPoint, that critical thinking PowerPoint of breaking down questions. Those were the four key things to think about. All right, let's keep going. All right, home health nurse is caring for a client with chronic peripheral arterial disease in both legs. Which client education should be included? Did you guys realize that on this quiz, there's a lot of med-surg questions? Right? And so one of the concepts that was covered in week 7 was care of chronic complex illnesses. Right? That comes from your med-surg. Okay, so what's the right answer here? Or why? Why is that the right answer? Why is A the right answer? What's going on with chronic peripheral arterial disease in both legs? What's going on?
Because smoking is one of the I guess like one of the causes of the chronic peripheral arterial disease.
Okay. Anybody want to add to what Lakeisha said? Why is B incorrect? Go back to med-surg and what you learned about this chronic disease.
Because there's no edema in this
Okay.
disease.
Okay. Why is C incorrect? What is C? When would you use C? Which particular chronic complex disease?
I guess would C be like if you have a blood clot?
Mhm.
Position.
Yeah, I'm trying to get you to think of why you wouldn't. It's important to get why you got the correct answer, or why the correct answer is correct, but why are the others incorrect? You have to be able to think through that. Make
Wouldn't
sense?
a pill like decrease the circulation like all the way
Mhm.
to the toes?
Well, what is the most important thing? I think Lakeisha said at the beginning, the smoking. The smoking with this particular chronic illness, right? That's what has to be addressed first off the bat, right? All right, let's keep going here. So now we're talking about COPD. So the last question, we've had a surgical question here. Now we had a med-surg question here, and now we're talking about COPD. Okay, so these questions come from that concept of chronic complex diseases. All right, which dietary modifications should be used with a client with COPD? What do we know about COPD? Why is C the correct answer?
Because the client has difficulty breathing, and so eating can cause more difficulty breathing. So resting.
Go ahead.
Eating smaller meals and resting before a meal.
Resting before a meal. Okay, what's A gonna do? Why is A incorrect?
It's just going to make it harder for them to breathe.
Too much exertion, right? Eating large meals. What about B? Why is B incorrect for a COPD patient? Limit non-caffeinating fluids. Why is that incorrect?
No, they need to drink fluids. They need to drink, not restrict. Any fluids
Okay.
to loosen secretions.
Mhm. What about D? Why is D incorrect?
They need their oxygen while eating.
Hey, anybody else want to add to what Abigail said about why D is incorrect? Okay, let's go to question 9. We're almost done. The home health nurse is caring for a client with cirrhosis who lives alone. Which intervention is a priority? What are you going to pull out of this question? What important cues, phrases, words do you need to pull out of this question?
Lives alone.
Yep.
Cirrhosis and priority.
Yeah, there you go. Lives alone, cirrhosis, and priority. Okay, and then what do we know about cirrhosis from your notes and your readings? What are some potential side effects?
Fatigue, weakness.
Mm-hmm. Okay.
Unstable gait.
Unstable gait, which puts them at risk for fall. And they're living alone. Right? So when you're doing your home health nursing assessment in the home, you've got to do your safety assessment. Safety and environmental assessment. Okay? Evaluating gait and environmental fall risks. Excuse me. Okay. Okay, another complex chronic illness. So a lot of these questions are coming from that concept. Which food should be avoided by clients with poorly controlled hypertension? It's pretty obvious,
Yeah.
right? What's wrong with canned soup?
Too much
Too
salt.
salty.
Full of salt, right? Okay, so a lot of you did well on the exam. Do you understand how it's important to break down the questions? DeChantel, can you turn your camera on, please? Celine, I need your camera on, please. Alicia, I can't see you. I can only see your hat. There you are. Celine, are you there? DeChantel? There you are. Celine, I'm not sure. All right, let's look at some content. Okay, so we've got our week 7. Last week was our exam, so we're going to review our week 7 content and our week 8 content, and then we'll do our group presentations. Okay, so let's pull that up. Everybody see my screen?
Yes.
Okay, so last week we covered infectious disease prevention and control, or that's what your readings and your preparation was about. HIV, TB, sexually transmitted diseases, and then we covered bioterrorism and disaster. So there's where you had a couple of bioterrorism disaster questions in your quiz. You had one of STD in your quiz. And then the other questions were from week 8. All right, so let's talk about infectious disease prevention and control. I'm sure a lot of you work in facilities where you're always hearing about infectious disease. Okay, but infectious disease goes into the community as well. Why, especially in public health? Why is it important to be monitoring infectious disease, let's say outbreaks in the community? Think about the pandemic.
To control the spread
Mm-hmm.
of the disease.
Yeah, and what kinds of think about the community, physical, biological, social, and cultural factors, right? All that factor into infectious diseases in the community. Okay, the one thing with infectious disease that I want you to know, it's called the epidemiological triangle. Okay, who can tell me what the epidemiological triangle is?
Is it like the host, like
That's one.
how it starts?
Okay, well, how does it start? Well, first, let's step back. What are the three factors for the environmental epidemiological triangle?
Host,
What do
agent,
you
and
have to
environment.
have? What do you have to have at the beginning? You have to have an agent,
Mhm.
right? What's an agent? Give me example. What kind of agents could you have? Agent is what the
Like
infection
a
is. Go ahead, Kadisha.
I was just gonna say like a virus, a
Mhm.
bacteria, a fungus, and
Yep.
that's it.
Chemical. All right, so you have to have an agent. The epidemiological triangle is made up of the agent, the host, and the environment. Okay, and these are in your notes right here. Okay, the agent, what is causing it? Is it influenza? Is it COVID? Is it a chemical exposure? Is it some kind of a viral illness? You have to have an agent, right? And then it infects the who, the host. Who is the host? That's us, right? Tiara, you were talking about that. You have to have an
Yeah.
agent that infects a host, right?
Mrs. Marble,
Yes.
the epidemiology, is that like the cause? Is that the cause triangle? Like epidemiology, I'm trying to
Yep.
figure out. Okay.
Yep. So your epidemiological triangle is your agent, your host, and your environment. Okay. So think about the host. We already talked about what kind of agents we could have. Think about the host. What affects us? Let's go back and think about the pandemic. If you were an elderly person in a nursing home, were you more susceptible versus a kid?
Yes.
Okay. So the host, are we healthy? Are we not healthy? Do we have good nutrition, poor nutrition? Does our age is our age a factor? Is our ethnicity a factor? Those are all the things. Are we healthy or are we immunocompromised? So they're all those things can affect the host, right? And then the environment. Again, let's think COVID. Let's say you were in a facility, you were more at risk than if you were at home or in the schools, right? So all these three together are what we call the epidemiological triangle. So if your agent was COVID, your host was, say, you guys, healthy group, okay, and your environment was, say, at school, you were much less at risk than the agent being the COVID, the host being an elderly person, maybe with comorbidities, and the environment being a rehabilitation center or a nursing home or an assisted living. Does that make sense? These are all you can create many formulas, many scenarios out of an agent, a host, and environment. But all three play a role in the epidemiological triangle. Okay, there's a couple of kinds of immunities I'd like for you to be aware of. Did you guys read about passive and acquired immunity and herd immunity? You want to tell me what they are without looking at your notes? What's passive immunity?
You get from the mother to the baby or from immune globulin.
Mm-hmm. Yep. What about acquired immunity?
From a vaccine or from the disease itself.
Mm-hmm. Mm-hmm. Did you guys review these? What's herd immunity? We heard a lot about herd immunity when we were talking about COVID, right?
It
Herd
passing
immunity.
in,
Go ahead.
like it passing in the community?
Say that again.
Is it from it like passing it in the community? Like,
Right? So herd immunity, right? You have a certain amount of the population who is now protected. So let's say the majority of the population got COVID. Okay, and they've developed the immunity through the vaccine, through natural immunity. So you have a certain percentage of the population who has herd immunity, which is what we were trying to move towards, right? The more people that we could have with herd immunity, the better the community was protected. Does that make sense? Then you also have transmissions. We're still talking epidemiological epidemiological health here. You have vertical transmission, you have horizontal transmission. All right, so vertical, mom to offspring, right? Horizontal, person to person. Okay, other than the parent to the offspring. Okay. What's the difference between epidemic and endemic? Without reading your notes, what did you guys learn from your preparation?
Epidemic is a disease that goes above the regular levels, which is the endemic. It's like the baseline.
Okay. And what about endemic? I'll give you an example of endemic, the flu. All right, it's
Yeah,
always
it's a
going to be
baseline.
around, right? Kadishi, we're going to say something? No? Okay. Okay, we talked about this in prior classes, but one of the things we need to think about as far as community contamination, okay, for communicable diseases, infectious diseases, is the air, the water, the soil, and the food. Remember that conversation? And that kind of contamination? We know that proper hygiene is the single most important aspect of medical asepsis and infection control. We practice that wherever we are, whatever settings we're in, correct? In the home, when you're working as a home health nurse, why do we wear gloves? When do we wear
Right.
gloves? When do we wear gloves? Why?
For dressing changes, if you're going to come in contact with bodily fluids.
Mhm. Somebody else pop in here. Why else are we wearing gloves in the home when we're doing our home health visits?
to also protect the patient and yourself with any contact.
Mhm. What about the disposal of contaminated equipment or
Biohazard bags.
And the
Pardon
Tide
me?
plastic bag.
Biohazard bags.
Mhm. Okay. The other thing to know with regards to infectious diseases is the requirements of reporting. When I was in the schools, it was an infectious disease reportable handbook that came from our local health department. And if there were certain communicable infectious diseases that were reported, some had to be reported on, others did not. Example, pertussis I'm thinking school, pertussis had to be reported on. Any kind of hepatitis had to be reported on. Chickenpox did not have to be reported on. Pertussis had to be reported on. So it's important to know that there is a national database of reportable diseases, but then when it moves down to the state level and the local level, that may increase or be modified based on their requirements at the local level, right? And you can find a list of those reportable diseases on the CDC website. So in the community, we have surveillance outbreaks. Okay, what's the difference? There's a difference between observation and surveillance. What is that? What is observation?
Maybe like
Observe.
looking at the effects of the disease or how it's spreading.
Go ahead, say that again, Taylor.
Maybe like just like looking at like whatever is going around or like seeing what the symptoms are.
Yeah, think nursing process. Think your ADPI here. Right? Observation, you're assessing public health status, identifying trends, disease patterns. What are your goals? Okay, what's going to be your rapid response? And how do you evaluate your program? Okay, where surveillance, on the other hand, you surveil to reduce morbidity and mortality. Right? You're trying to prevent the control, or you're trying to control the spread. Okay. The other thing with outbreaks is patterns of occurrence. Think of how things happen. Okay, you have several. Or I'll just highlight it right here. Point source outbreak. Okay, a point source outbreak when everybody's exposed to something at the same time. Okay, everybody gets sick. So maybe a gas is released on a train, right? Everybody's going to be exposed and everybody's going to get sick. The next kind of an outbreak is an intermittent outbreak. Okay, where you are exposed over a certain period of time. People get sick at different times. Okay, an example of that would be food poisoning. Let's say a restaurant's using lettuce, I don't know, and they're using over a 3-day period. Same batch. Okay, people get sick, get exposed at a different time, get sick over time. That's intermittent. Okay, and then you have a third source of an outbreak. It's called a mixed outbreak. Okay, these are person-to-person spreads. Okay, the best example of a mixed outbreak is a flu, influenza, person-to-person. And then the last type of outbreak is called propagated. Okay, these don't have a common source. Okay, and they eventually spread from one person to the other. The best example of a propagated is TB. Okay. So please understand the difference between all these types of outbreaks. Okay. And then the other thing that I want you to know about is when you're doing a needs assessment. Okay, so let's say we are doing community-based programs and we're wanting to do a needs assessment. Okay, there's a few stages for you to be familiar with. Okay, we have the pre-active stage. Okay, in which we project our future needs. Then we have a reactive stage. Okay, in the reactive stage, we're trying to determine the problem using past identified needs. Okay, and then the inactive stage. We have an inactive stage. And that's trying to define the problem based on existing health status. And then the last one is your interactive stage. Okay, where we're trying to describe the problem using past data, try and project future needs. Okay. The other thing to talk about within infectious disease is vaccines. Okay. Did a lot of my school nursing work with vaccines. Okay. The most important thing for us to do is to communicate to families that vaccines are the most effective way in preventing and controlling communicable diseases. Okay, but there are families, parents that choose not to vaccinate. What do you do when that happens? What do you do? Do you judge them and scold them? And what do you do?
You have to respect their decision.
Absolutely. Absolutely. So you reiterate the education. I can't tell you the number of times I had families when we were contacting families that chose not to vaccinate. They either had to do a personal exemption, religious exemption, medical exemption, but ultimately it was their choice. So what we can do as educators and nurses is try and educate on the importance of vaccines. That's it. We can't be judgmental, right? We can't scold them for not wanting to vaccinate, but we can educate. Okay? There are some groups. Well, we all know about childhood vaccines, right? The common childhood vaccines. You can read through this paragraph, right? That cover the Tdap's, right? The polio, diphtheria, pertussis, measles. We all know about all of those, but they've added varicella vaccines, they've added COVID vaccines, hepatitis vaccines, HPV vaccines. Okay? HIV infection, hepatitis, TB, and STDs. That's our next concept. Okay, we know that STDs are huge, major public health challenge, right? We know that we have bacterial infections. We know we have viral infections. Okay, with regards to STDs, the most common bacterial infections, gonorrhea, syphilis, chlamydia. And what happens with bacterial infections? Can they be cured with antibiotics? Bacterial.
Yes.
Okay.
Not viral.
Right, exactly. So what happens with a viral STD?
You could treat the symptoms.
It's lifelong symptom management. Right? One of the STDs that we need to be aware of is syphilis. Okay, syphilis is an STD that can be transplacentally spread. Okay. So when you're assessing early pregnancy and you're assessing for STDs, one of the things that is screened for is syphilis. Right? If you go through a pregnancy with syphilis and it's untreated, potentially has devastating effects for the fetus, for the newborn. Okay, so in your notes, there's information about chlamydia, about syphilis. Okay, you also herpes and genital herpes, viral and incurable, right? We know that about herpes and genital herpes. It is viral, so it's not curable. And there's your information on herpes, hepatitis. Some of you did your paper on hepatitis. Okay, you need to know the difference between hepatitis A, hepatitis B, hepatitis C. What is hepatitis A? What's the difference?
Fecal.
Anybody?
Hepatitis A is spread through fecal or oral contact.
Mm-hmm. Mm-hmm. About B. Without reading your notes. Bloodborne, right? Hepatitis B is bloodborne. And what about C?
Blood.
So for the liver, cirrhosis, high in drug users.
Yep.
Sure, I need those syringes.
So is it hepatitis A, B, and C. Then you have your HIV. How is HIV spread?
Sexually.
Needle
spit.
Yep. Yep.
Blood.
Yep. Can also be spread, don't forget, vertically,
Yeah,
right? Through breast milk, right? And here was your quiz question about retesting for HIV after 3 weeks or 3 months, right? So the client needs to understand that the HIV test cannot identify infections that may have been acquired within the previous 3 months, right? So appearance of any kind of antibody, HIV antibody, can take up to 12 weeks, right? So it could be negative now, but it could be positive in 3 months. Okay. TB, what do we know about TB? How is TB spread?
Airborne.
Airborne. How is it treated?
Rifampin. I mean, any of the TB drugs. INH, pyrazinamide, all those.
Okay. How do we care for clients with TB? Very contagious.
Isolate them.
One of the things that is interesting about community nursing is that, let's say you have a family that a family member has been tested positive for TB and they're on a medication regimen. I don't know if you're aware, but there are certain times that community nurses have mandatory visits and non-mandatory visits. So let's say there was a suspicion of child abuse, right? Child service is going to visit you. If you are on TB medication, the health department is required to visit you. Did you guys know that? They're required to visit you to make sure you're taking your medication. If you're in the hospital taking care of somebody with TB, we're trying to isolate them. N95 masks. Try and have a private room. Okay. And then, of course, we work with lots of vulnerable populations in the community where the risk of TB is high. Talked about that. Homeless shelters, crowded living conditions, migrants living in crowded living conditions. Several different environments that the risk goes way up for TB, right? Bioterrorism and disaster management. There's 2 kinds of disasters. What are they?
Natural, man-made.
Okay. Somebody give me an example of a natural disaster. What are some natural disasters?
Like hurricanes, tornadoes.
Yeah.
Okay, they're naturally occurring. And then you have man-made disasters. What are some examples of man-made disasters?
Maybe like the oil spill.
War.
Pollution, fires.
Yeah. Cynthia, are you going to jump in?
War.
Yep. Yep. So let's say you're in the community and you're working with family and you're trying to do primary interventions. And so you're helping them prepare for a potential disaster. And you want to put together you want them to put together a disaster kit. Okay, very common. Okay, here's a couple of things that they need to be prepared to pack or prepared to have ready. Okay, and I'm right here. Okay, so as we're working and teaching, remember, nurses are expected to be able to participate in any phase of a disaster. Okay, whether it's preparation, whether it's during the disaster, recovery. Okay. In the preparation phases, we're doing exactly this, preparing families, preparing a community for a disaster. During the disaster, nurses, we can be triaging clients, we can be working in shelters, we can be expected to do a variety of things. In the post-recovery phase, making sure clients are getting their medication, making sure doing home safety assessments. Okay, we are expected to participate at any phase of the disaster. Has anybody ever participated in their work with disaster drills? It's standard operations at this point. Has anybody done that? I'm just going to stop sharing for a minute. Has anybody participated in disaster drills?
Yes.
Somebody like in school when you was kids?
Yeah.
We do
Schools?
this in our facility every once in a month or something like this.
And what do you do?
For tornado drills, fire
Tornado?
drills.
Okay.
Yeah.
Okay. Anybody else? Anybody participated in one of those mass casualty exercises?
No.
Okay, where you have sick patients and you go through a whole disaster from start to finish. Okay, they're
Nope,
pretty.
haven't seen that one.
You haven't seen that one, Tiara?
No.
Yeah, they're pretty big. They involve everybody who would be involved in a disaster, from first responders to actual patients. People act as though they're patients, from first responders to transportation to what everybody's role is, command center. Yeah. We do lots of drills and lots of training. And you should be in your facilities that you work in. Okay. Let's see. Oh, I want to mention the National Response Framework. Okay. A federal agency. Once a disaster has been declared, I know we always think of FEMA, right? Everybody knows what FEMA is, the Federal Emergency Management, right? But there's also another federal agency, National Response Framework. Okay, and they come in and they provide 5 specific services. Okay, they help with transportation, temporary housing, medical resources, search and rescue, and firefighting. Okay. We always hear about FEMA. We rarely hear about the NRF, but it's important to know that they're also part of a disaster response. Okay. There are a couple of different agents that you should be familiar with regards to bioterrorism. And these are on your HESI prep as well. Okay, so anthrax, what does anthrax look like? Smallpox, that was on your quiz. What's the difference between smallpox and chickenpox? How would you be able to tell the difference? Just one significant difference.
Smallpox is on the palms and soles of the feet. Chickenpox isn't.
That's correct. Did everybody know that? That's the one big determining factor between smallpox and chickenpox. Okay, soles of the feet and palms of the hands. Few other things to mention with regards to bioterrorism and disasters is foodborne disasters. Okay. Think about when you go to a restaurant. I expect that the food's being prepared correctly. Do you? You expect that everybody working in that restaurant, back in that kitchen, is doing everything that they should be doing according to their OSHA standards, right? Remember the occupational safety and environment? Remember that? Occupational safety healthcare. Okay, who sets the standards for foodborne preparation. And however, if there's an illness, they will be there to investigate that. We talked about that when we talked about environmental health a few weeks ago. Right, so there could be issues with foodborne illnesses. There could be issues with waterborne illnesses. There could be vector-borne illnesses. What's a vector? What's a vector?
It's
What
like
kinds
a
of
mosquito.
vector
Hive
illnesses?
disease.
What? Go ahead, Tiara.
Is it like an animal or?
Yeah, it comes from an animal or
Insect,
yeah.
right? So some examples of vector-borne diseases: Zika virus, Rocky Mountain spotted fever, Lyme disease, malaria. Okay. With regards to concepts for this week, home care. Okay, what about home care? Community health says that home health care visits are the most important kind of visits to do with our clients. Why is that? As opposed to visiting your client in their hospital room.
Because you get to see like what their at home life is like, if there's any safety hazards or just how they live.
Mhm. You get to see this.
Individual care,
Go ahead.
individualized care, and able to spend more time with them.
Mhm. Right. So home health differs in compared to other places where we provide care, where home care is in the client's environment. Right? It's individualized care to our clients. Okay? We get to do safety assessments. We get to do environmental health assessments. We get to do family assessments. We get to look at family dynamics, support systems. We get to do financial assessments, abuse assessments. Right? Being in the home gives us the opportunity to look at the whole picture. Another big factor in home care is collaboration. Okay, collaboration with others, there may be a physical therapist involved, there may be an occupational therapist involved, there may be a health aid person involved in the care. All right, so within home care, it really is a collaborative team effort. Okay, and then the differences between Medicare and Medicaid with regards to home care. Okay, the biggest difference is the skilled nursing services. Okay, the documentation of skilled nursing services. So that wouldn't be home health aides going in and doing ADLs. That would be a skilled nurse going in and doing IV antibiotics, wound dressing changes, teaching families how to care for their family member. Okay. As far as community resources, as a community nurse, public health nurse, you're expected to know what resources are available in your community. Okay, because think about it, your clients can be anywhere from infants to the elderly. Your clients could be an individual, could be a family, could be a subset of the population. Okay, so every client that you're working with in the community is probably going to require a different set and a different level of resources, right? Because ultimately the goal is with these resources, you're helping them reduce their vulnerability. You're helping them manage complex chronic illnesses, and you're trying to help them be as independent as possible, right? So one of the things we talked about, and we've talked about this before, is what do we do with the large parts of the population that are non-English speaking in our communities? Who are we going to rely on? Who can help us bridge that relationship with a different culture and a different culture that speaks a different language? Who can we reach out to in the community? Remember, the community is all about a team effort. You're always reaching out to key stakeholders in the community to help you. Right? So,
Leaders,
pardon me?
leaders
Mhm.
of the group that can speak English or your language.
Right? All right. So the first step in building trust with the non-English speaking community, right? Find your trusted community leaders, like Abigail said, maybe religious leaders. Right? Let's say you have a large culture of violence in your community. Maybe reaching out to law enforcement, partnering with them. Right? Let's say you have a high suicide rate amongst kids and young adults. Well, maybe you're partnering with your mental health resources in your community. Or you have a community that has an issue with substance abuse, drug use, overdoses. Well, you partner with your mental health and your whatever community resources you have to help treat these people. All right. So as a community nurse, you're always reaching out and trying to identify your key stakeholders. Maybe it's, if there's a language barrier, maybe it's interpreters. Maybe it's a religious leader. If it's crime issues, law enforcement. Education issues, dropout rate, reaching out with the school liaisons. And mental health, we talked about. Does that make sense? Community resources are so important to know about as public health nurses, because everybody needs some kind of resource, right? We talked about case management before. What's a case manager? What does a case manager do? What does a case manager do?
Manages care.
Remember, they're the coordinator of care, right? They're the
Yes.
coordinator of care, right? And typically, case managers are reserved for the complex chronic patients, right? Multiple comorbidities, like somebody who's had a triple bypass and is going home and they need to do cardiac rehab, and they live with family, and their appointments are all scheduled. They don't need case management. But let's say you have somebody going home with nobody at home. They don't have any transportation to their cardiac rehab, right? They don't have anybody to cook for them. They don't have any way to get to their medications, right? They have no way to go pick up their their oxygen they might need. That's the kind of client that would need to be case managed, right? Maybe a substance abuser that has mental health issues, complex chronic illnesses. So not everybody needs to be case managed, but the complex clients do. Okay. And then we went through a list here of all you had several questions on these. All right, with chronic complex illnesses. These are the ones I want you to know about. Okay, cirrhosis, COPD. You had 2 questions about that. Diabetes is important to know about. peripheral artery disease, CVI, chronic venous insufficiency, and hypertension. Okay, so those, you were asked about several of those, but this is where this week is week 8 is very med surg focused. Okay, so you guys can go through those. Questions? That's a lot of content to cover. Okay. Any questions about content? We're not gonna have time to go over our presentations. We'll do that next week. We'll do that next Monday at the end of class. Okay. Any questions about all the content we covered? Okay, so you've got 2 of your 3 weeks of content. Next week will be the last week, and then that will cover exam 3. Okay, so really look at your notes and use your notes and fill in your study guide for these 2 weeks of concepts, and also you can fill out another good chunk of your HESI prep based on the content we just covered. And then next week, week 9 is our last week of content. Right, we've got a few more concepts to cover next week, and that's it. Content is over. Right, because week 10 you take the exam, and then week 11 you take your HESI.
Miss
So-
Marvel, are we gonna go over the HESI prep assignment before the HESI, or no? Because I know you
Well-
said just fill it out, anything that you would like to
Yeah.
study
Well,
on or whatever.
during the
Just so we can check it.
during the review week, which is week 10.
Mhm.
I know you're taking your 3rd exam, but it's also HESI prep review week. During our reviews, we go through the HESI prep. Okay. Okay. Questions? Well, I hope you guys have a good rest of the week. If you need to reach out to me and schedule a time to review, do your exam review, I'm happy to do that. Okay.
Happy
Otherwise-
Thanksgiving.
Thank
I
you.
hope you
Happy
guys have a good,
Thanksgiving.
happy Thanksgiving.
Happy Thanksgiving.
Have a
Happy
great week.
Thanksgiving.
Yeah,
Okay.
thank
You
you.
too.
All right.
Bye.
Bye.